Good afternoon, everyone. I'm Dr. Sarah Mustafa from DentistChannel.Online. Welcome to today's webinar about treatment options for a missing tooth. While we are waiting for the participants to join the session, I will introduce you to our company. DentistChannel.Online is a digital dental media company. It is your marketing solution for dental events, product launches, workshops, and courses. We also provide a collection of scientific articles and blogs about different topics in dentistry. We work hard to be your first-hand information on the technological advancements in the dental field. Now it's time to start the session about treatment options for a missing tooth. If you have any question about this topic, feel free to ask it in the Q&A box, and we will answer each and every question at the end of the session. I will start by introducing today's session speaker, Mr. Korya. He is an Iraqi-American student dentist who has been living in the US for over 10 years. Graduated from the University of San Diego with a bachelor's in biochemistry and cell biology and a minor in international relations. He is currently working on his doctorate of dental surgery at the University of Southern California. Held many positions: project manager for Operation Smile, account executive for Tom Ford Beauty and Fragrances, and recently wrote a paper about teledentistry that has been implemented by some clinics. Welcome, Mr. Korya. It's our pleasure to have you with us.
It's actually my pleasure to be with you guys. Thank you for having me. Perfect. Should we start our presentation?
Yes, please.
Awesome. All right. Hope everyone is doing okay. One second. Let me share my screen. Perfect. One second, I'm sorry. Having technical issues. Perfect. Got it. Awesome. So today's session, as we mentioned before, is going to be about treatment options for a missing tooth and like what are the pros and cons of each replacement treatment. Of course, missing teeth is basically one of the most prominent issues that people face with here in the US and other places. And it can be addressed or not addressed. Not addressing it is also a treatment. But it's one of the most prevalent topics and one of the most controversial topic on basically what the proper treatment should be for a missing tooth. And my basic answer for that would be every case is different than the other. Every case requires a different treatment than the other. There is no one ideal treatment for a missing tooth. You can't say, oh, implants are the best replacement for a missing tooth or FPDs or XYZ, because every person, every patient has a different requirement. So we always put it upon the discretion of the patient. We can't push a treatment upon a patient. We can certainly recommend based on the patient's health, patient's financial situation, and patient's factor in general, which treatment is best. But at the end of the day, we have, as dentists, to put all the options, all the pros and cons, all the treatment available for the patient, and upon the patient's discretion to choose which treatment best fits their needs at the spot. So let's first talk about missing teeth. A missing tooth should be the last resort. Like if the tooth doesn't get broken or the tooth doesn't get like damaged in a way or another, having a missing tooth is the last resort you want to have for a patient, because as we all know, your teeth are the best material you can ever have for a dental replacement. So there's no material that can replace your teeth and be as effective and as good as and as maintainable as your own teeth. Your own teeth are always going to be the best. You, as we all know, like you have teeth that stay with you for the rest of your life. No cavities, no problems. This tells you that this material is not replaceable. So we always want a missing tooth to be the last resort. A lot of dentists consider extractions as one of their first like destinations of escape, and that's, in my opinion, is devastating for the patient, because why remove a tooth that could be treated? So we always exhaust all the treatment options before we get to the very last resort, which is extraction. We do fillings, we do crowns, we do root canals. Even if the dentist thinks there's a lot of work to be done on this tooth, and um, extracting it probably would be the easier route for the patient and for the dentist, it's not recommended to extract if it's possible to not extract. So always keep it as your last resort. As we all know, with advanced dentistry, even if you're extracting, you will also have a treatment option. So we are never worried about that. But we still want to keep it as the last resort. We extract when all the other treatments have failed. We have no other option basically other than extracting. We extract. According to the Center for Disease Control and Prevention, by the age of 17, 7% of people in the US have lost at least one prominent tooth because of decay. So, what I mean because of the decay, that doesn't mean, oh, decay in a broken fell. A lot of it is also dentists extracting the teeth, which to me, 7% is a very concerning number. I bet you all that probably half of that percentage did not need extraction. But among adults, basically, and that's basically like the bigger percentage, the scary percentage to me. Among adults, 30, like from ages 35 to 44, there's 69% patients who have at least lost one tooth. That's actually concerning, because I can guarantee you that a very high percentage of these teeth did not need to be extracted. There could have been a different treatment done on these patients. And some of them might have needed extractions. If you need extractions, what are you going to do? So it's an option. It's just a very last resort. Okay, let's get into treatments. A lot of people forget sometimes that if a tooth is extracted or if there is a non-edentulous area in your cavity, always remember no treatment is a treatment. You don't have to perform a treatment on the patient in order to consider it a treatment. Leaving it is also considered a treatment. Leaving it untreated is also considered treatment. A lot of dentists avoid that aspect for many reasons, and one of the reasons is basically like root resorption or gum resorption, which is a major concern for non-edentulous areas, but we'll get that there in a minute. But we should know as dentists, leaving a non-edentulous area is an option for some patients. Would I personally recommend it? Of course not. Should a dentist recommend it or push for it? Of course not. But if the patient wants that, or if the patient feel comfortable with that, it's not a devastating option for the patient, and it's also a treatment option depending on the patient's factor. We always relate everything to the patient's factor, and we give recommendations. We do not push for a treatment because every treatment in the world of dentistry is prone to failure. I don't know, whatever you are in the world, in the US, if you push for a treatment and that treatment fails, the patient can come back at you. So we always want to provide the ideal treatment. Of course, there's always possibility of failure, but we want to minimize failure as much as possible and increase index of success. So if we talk about the pros of no treatment, as we all know, it's the cheapest treatment, $0. You're not spending a penny on that treatment. No surgical involvement, very easy, very clean, time efficient. Like, you're not spending a moment at the clinic trying to get a treatment done for your tooth. You will not have an issue depending on the size of the non-edentulous area. You, for the most part, will not have an issue with food getting trapped between your teeth, because no matter what the tooth is, the size of the space will not be small enough to trap food. So it's very easy to get it out of um, that trap. So having hygienic issues or having issues with food getting trapped in the non-edentulous area is not a concern for the no treatment option. So depending on the tooth, the patient might not have a problem with the missing tooth. So let's say the missing tooth is a second molar. Patient's smile does not show that specific patient smile does not show that area of the mouth. He's not worried about that missing tooth. He still has his first molar, he has his third molar, so he is not really worried about that missing second molar. Um, then we can't push for a treatment, even if we believe that another treatment would be better. But considering the patient's financial situation, considering a lot of factors, can play a role in this decision, especially that the patient have his first and third molar, then we're not as concerned as we are concerned for other patients. That case is completely different than the patient who is missing a first premolar that's showing whenever he smiles. This patient is going to feel different about that. But I added that to the no treatment pros because some of those teeth and most of the teeth that get extracted are posterior teeth, and posterior teeth don't usually show in the aesthetic zone. So a lot of patients don't have a problem with having a missing tooth that's not in the aesthetic zone. Going to the cons of no treatment. Those are cons that need to be addressed because I consider them one of the most serious cons than the other treatment. Um, Obviously, you're having an area of missing function. You can't bite on that area. You can't just bite on bone. I mean, to a certain extent, you can bite. Of course, you can bite mashed potatoes, etc., etc., etc. But it's a missing function. It's not a full function in that area. So that's the major consideration for patients who go with the route of no treatment. They have to always remember that they will be missing that function for the rest of their life if they don't get it treated. Obviously, one of the major issues is orthodontic problems. Teeth shift, space changes, size of the space change. So we always have to put that into consideration. We always have to remember and remind the patient that this is a major issue. Teeth shifting is a major issue. Like, imagine your teeth shifting from the midline, your central incisors shifting from the midline when they were originally in the midline. That's going to be an issue for you. So this is definitely a problem to be addressed because even people with non-edentulous areas can actually feel that space getting smaller and narrower with time because, as we all know, teeth shift. Depending on the patient, bridge resorption could be an issue, and that is issue that's very hardly treated. So that's something that patients have to consider. Poor prognosis in the area, of course, because the jaw deteriorates, and as we see, um, we always see like a concave area after a while of a missing tooth, and that's because of the bridge resorption and the jawbone deterioration. So that's something that you always have to mention to your patient. Yes, there is the comfort and ease and low cost aspect of no treatment, but there is a greater chance of other issues that the patient might face. Implants. Okay, implants. I personally, I'm not, my personal bias opinion, I think this is the best treatment out there because dental implants. What are dental implants? Let's talk about them first. Dental implants are surgical procedures that interfere with the bone of the jaw. So you are implanting in, as shows in the picture on the right, you're implanting a screw in the bone to support the dental processes as like such as crowns, bridges, and other treatments. So you're basically implanting the root of the tooth in the bone mechanically. The major material that is used for dental implants is titanium because titanium has showed better prognosis than other material and better maintenance, less corrosion, and a lot of other aspects that made titanium the superior material for implants. And the minimal studies that have been done on implants, titanium has showed to be the best material. So here in the US, we have admitted titanium as the major material used for implants. It's not a very common treatment because of a lot of factors that we'll be talking about in a bit, but it's progressing crazily. Only 0.7% of patients had implants in 1999. In 2015, we have 6% of patients who have implants. There aren't fixed numbers. I tried to find the fixed numbers for today. There aren't fixed numbers for today, but I can assure you it's at least double that 6% today, which is a very good progress in my opinion. Okay. Okay. What are the pros of implants? To me, this list can go on. There are so many benefits and so many pros to implants. You get the comfort, you get the durability. Implants are strong. Implants are stronger than your actual like crowns or bridges, or your teeth are the strongest. I would say if there is a material that comes after, it's implants. It has a very, very high success rate. As long as you're doing the right thing, you're implementing the bone, the like implant in the bone rather than in the soft tissue, there's no reason for it to fail. Um, this is a big aspect. There is no adjustment made to adjacent teeth. If you're implanting a second molar, your first molar and third molar have no cavities, they're gonna stay the way they are. There's no drilling, there's no filling, there's no crown preps on adjacent teeth. That's a really, really big thing because say this um, tooth fails or this implant fail, there is separation of failure. Only that area will fail, not other treatment options that we'll go over. Some other treatment options, if the treatment for that tooth fails, we're creating a bigger issue for the adjacent teeth. So the best thing about implants, there is no adjacent teeth involvement whatsoever. It has a better overall prognosis and less damage to adjacent teeth, like we mentioned. Premium aesthetics. A lot of those implants, depending on where you get them done and where they get fabricated, a lot of these implants cannot be differentiated from your actual teeth. And that to me is a very major aesthetic score that implants have progressed with. Obviously, you have the proper function with a proper implant, easy accessibility and easy cleanliness because they could be shaped in a way where they could be flossed and cleaned properly. And also, when you get scaling and like root planing, at a dentist's office. Today, they usually use with that titanium plastic scalers, and that is, to me, an amazing progression, because back in the day they used to use the regular metal scalers used for actual teeth, and that's not good for implants, as we all know. But now everyone's using those plastic scalers for these teeth. Cons. um, this procedure takes a very long time. You implant the bone. By the time you implant an artificial bone in your bone, it takes months to adapt, and then you place the screw, and then you place the tooth itself. It's a very tedious and long process that can take up to 6 months. A lot of patients don't have that much patience, and a lot of them are just poor at recall. Like, you implant the artificial bone and they just don't show up again, and that bone resorbs and an implant is not placed. So, as we all know, a lot of patients are not very on top of their recall sessions, and that could be an issue or a con for implants, which itself is a failure of following up. And that's very common in implants compared to the other treatments. Obviously, very, very expensive. It could cost, depending on where you get them done, from $2,000 to $5,000. We always have to put that aspect as a factor in considering it for the patient. A lot of patients cannot afford that for a single tooth. Most of the patients cannot afford that for a single tooth, depending on where you're practicing, of course. So always put that in the front line so that the patient does not get their hopes up and then they realize that they can't afford this treatment. Um, Obviously, it requires a special expertise here in the US. Dentists don't usually feel comfortable doing it until they go to a couple of CE courses that are implant dedicated, because it's not a joke. It's a surgical procedure that could fail. And if it fails and the patient spend that much money, it's not going to look pretty. So um, basically, there are other issues that are involved with it, which is basically bone issues, nerve damage, and a lot of other issues that require involvement. Can be severe for certain treatments, for certain patients, sorry. So obviously, like, not everyone can handle the surgical procedure. Not everyone can handle the waiting from 3 to 6 months. The surgical procedure could involve a lot of like um, like opening in the soft tissue, a lot of bleeding, a lot of possible infection if the treatment is not done properly afterwards. If the patient did not follow up with the antibiotics, they could be prone to infections, and that's something that should not be taken easily, or it's not something that should not be put into consideration. That's something that's dentist's responsibility to follow up with. Um, and the last thing that I consider is a little controversial topic. There isn't enough studies done on implants. I think there are good enough studies for us to think that implants are safe, but obviously they're not studied as much as the other options like RPDs and FPDs. Speaking of FPDs, FPDs is another treatment option that's very common for a missing tooth. It's actually, in my opinion, it's the most common treatment for a missing tooth, which are basically bridges. What are FPDs? Fixed partial dentures. Fixed partial dentures are basically a dental restoration used to replace missing teeth, um, and by creating a permanent attachment to adjacent teeth. We call those adjacent teeth that basically adjacent teeth carry the load of that missing tooth with restoring function and restoring aesthetics. The adjacent teeth, we call them abutments. And those are basically like stages that hold the bridge. Like, you know how when you have a bridge, let's say over a sea, both areas of land that are supporting that bridge are the abutments. They were found in 1973 and they've been widely used over the years. Benefits or cost of FPDs. There have been numerous studies available on those, so we know what are the pros and cons of these bridges. We know the prognosis, we know what's the estimated time of survival. We know all these information because there's a lot of studies done on this treatment. We're not going in a gray zone where we don't know what's going to happen. We know what our options are. And that itself is very comforting to the patient and that gives confidence to the dentist to speak about this treatment. It's very cost effective compared to implants. Obviously, it's not as cheap as no treatment because that one is basically free, but it's way cheaper than getting an implant done. So that's always an aspect to put out there for the patient. I did not mention any numbers here because there's a huge like wide variety of a price range for depending on where you go or the dentist you go to. The best thing about it is it maintains teeth position, and that's one of the main issues we mentioned with no treatment. This one basically, even if you are not in need for a treatment, like you don't need a treatment, at least this maintains the teeth position. So you don't have orthodontic issues, you don't have shifting, etc., etc., etc. FPDs solve this problem. We don't have a surgical involvement, which you could see a lot of patients approaching that due to this aspect. Like, as we all know, some patients are even scared of a needle. So can you imagine you're telling them you're digging in their soft tissue, digging in their bone, a screw, and then a tooth? Just thinking about it might scare some patients off and they wouldn't even get that treatment, even though we all know it's a very successful treatment. So as we all know, putting patients' preference first, even though we make our recommendations, sometimes patients just don't want to go with our recommendations. This is an option where patients don't go through a surgical involvement. Basically, you're just getting crown preps on both sides, and that's it. And obviously, it's an aesthetic option, depending on where you get it done and with who, and who your lab is. They could be very aesthetic, they could look like natural teeth. Now, cons of FPDs. There's a big list for the cons of FPDs that should not be underestimated, because those are actually serious cons. There is a very high complication if it fails, because you're basically, like, we already know that this tooth is failing, but along with that, you created damage to the adjacent teeth, possibly two or more. So I bet you the patient will not be happy about that. And you will not be happy about that because you have created damage to that whole quadrant. A whole quadrant could be damaged if this treatment fails. So we always have to put that into consideration, and we always have to put that as an option for the patient. It's not conservative on adjacent teeth at all. Like, it just makes my heart hurt. Sometimes a tooth is perfectly fine, no cavity, nothing. You have to actually drill into it and do a crown prep for that tooth just to create that FPD. That's one of the major cons for this treatment. Depending on the size and the shape of the compontic, there could be a difficulty cleaning it. You could have a problem with cleaning it. That could trap food, trap bacteria, create secondary caries, create caries on the abutments, and we all know how that will proceed. So we always have to pick the right pontic for the right area. The pontic, for those of you who don't know what a pontic is, it's basically the tooth that replaces the non-edentulous area. It's basically an area that's not implanted in the gum, but it's there to support basically the bridge for aesthetics, it's basically the major aspect of an FPD that does not carry the forces. The forces are carried on the abutments. very specific instructions on the abutments needed for it to succeed, which we will talk about those in a minute. But you can't just create an FPD on any teeth, because sometimes the adjacent teeth or the abutments cannot carry that FPD. So you're setting that procedure up for failure for the patient. So that's another thing that we should always make sure that if we're doing an FPD, we're doing it in the right terms, or don't do it. I'd rather have a missing tooth than a missing tooth plus two damaged teeth that were fine. Um, does not prevent root resorption, and that's something to put into consideration. It does not prevent. Um, we're basically filling a space, but we're not filling, or we're not reserving the bone. We're not touching the bone. You still have a missing tooth as far as connection to soft tissue and bone, but you're filling the space for eating purposes, for aesthetic purposes, function purposes, etc. But that doesn't mean root resorption will be prevented, because the missing tooth is still there. And as we mentioned, there is a very high failure rate and fairly poor prognosis. Obviously, if it's done right on the right teeth, there's no reason for it to fail, but it could go wrong easily. And if it goes wrong, or a very little thing goes wrong, that sets up for failure. Overall, they usually have a good prognosis for about 10 to 15 years. But after that, even if it was a good FPD, usually deteriorates. We mentioned earlier considerations for FPDs, for the abutment teeth. You always have to consider these aspects. Mainly for talking about the preparation, mainly POI. You have to have the right POI to support your FPD. Think about it as a bridge. Imagine you have a bridge and the points holding the bridge are like that. Eventually, what's going to happen to the bridge? It's going to disconnect, or it's going to rip, or XYZ. There's a lot of aspects that could affect the health of that bridge, but having the proper POI is the major one, in my opinion. Size of the preparation is very important for support. Marginal finish. Those are all factors basically that can affect the prognosis of the FPD, that could elongate the FPD 3 more years or shorten it 3 less years, depending on how the dentist performed that procedure. So FPDs are in comparison to all the other treatments, are very, very, very technique specific. Dentist technique specific. If the dentist does a good job, prognosis is good. So that's the procedure where you actually can flex and show how good you are at what you do. We have to always consider periodontal health. If the patient's periodontal health does not help, we obviously don't want to do an FPD because it's going to fail. Size of the tooth itself and the crown of root to ratio. We do not want a crown that's bigger than the ratio, other than the root. If the crown is bigger than the root, there will be no support. We always want the root to be at least as big as the crown, or bigger. The bigger the crown, the root to crown ratio, the better prognosis those will have. If we want to do an FPD and the root to crown ratio is basically less than 1, the root is smaller than the crown, we have to do secondary FPDs, which is basically do 2 abutments. We don't do 1 abutment. We have the 2 main abutments, but let's say this tooth is basically the tooth that has a compromised root to crown ratio. We prep that one and the one adjacent to it to support the FPD. So that's something to also put into consideration, because that's even more damage to teeth that do not need to be damaged. And also, obviously, tooth health and vitality. We do not want to do it on a tooth that's very close to extraction, because that's going to be just setting the patient up for failure. Removable partial dentures, not very different from FPDs, but they're removable. I would say this is my least favorite treatment, even less favorite than the non-edentulous area for a single missing tooth. If it's multiple missing teeth, yes, this would be a treatment to be considered. But for a single missing tooth or two missing teeth, that's definitely, to me, is the last resort. Removal by partial denture is basically a denture for a partially dentulous patient who desires to have replacement for teeth for function and aesthetics. Obviously, it could also be done for a completely non-edentulous patient. So a lot of patients go that route because it's the cheapest treatment. Basically, with that restoration, you cannot have a fixed partial denture due to many reasons, and those will be discussed. If you can't have a fixed partial denture, that's the replacement. What are the reasons? We'll mention those in a bit, but as we all know, mainly financial limitations would be if the patient cannot afford an implant or an FPD, this is our resort, or lack of required criteria for abutment teeth. Like we mentioned, if the patient just doesn't have the proper adjacent teeth for an abutment to support the pontic, what are we going to do? This is going to be basically our resort. Pros: no surgical involvement, just like FPDs, cheaper than FPDs and implants, and covered by a lot of insurance companies. That's also something to consider. Fairly easy placement and removal if done right. If not done right, patients also struggle with those, but if done properly, fairly easy placement and removal. Restores function and aesthetics to a certain extent, obviously. Cons: they're very highly prone to cavities. They're removable, so anything that's removable is even harder to maintain the hygienic aspect of it compared to fixed. Harder to maintain hygiene, not conservative on adjacent teeth, just like FPDs, and need more special restorative space. So basically, along with all the cons that we mentioned in FPDs, those add to them the less comfort, the less hygienic aspect. So they're definitely not as good as other treatments, but they're treatments that are done by a lot of people. They're the most cost-effective treatments after no treatment. So that's something that is to be considered for payment-driven patients. Thank you very much for listening, and please let me know if you have any questions.
Thank you so much, Mr. Karam Korya, for this interesting webinar.
Thank you. Should I stop the share, doctor?
Yes, please. So meanwhile, I will ask your permission to introduce our company to all the participants. And
Absolutely.
I request all the participants to kindly put their questions in the Q&A box if they have any. So this is our organization, DentistChannel.Online, Healthy Smiles, Wealthy Lives. I request all the participants to kindly save this number and send a WhatsApp message with their name, so they will be added to our broadcast list and they will receive everything about our upcoming dental webinars and workshops. Today's webinar is sponsored by NovaMind. NovaMind offers a full spectrum of implants and prosthetic solutions that accommodate any clinical need in modern implantology. We successfully supply highly demanded dental implant types called internal hex, tissue level, bone level, and active conical connection. Our EU production unit and product quality is appreciated worldwide. Dental implants and dental restorative solutions produced maintaining all the standards of EU medical device regulatory. Products are manufactured in Athens, Greece, and distributed worldwide with more than 1 million happy restorations. Those are the offers by NovaMind, and if you want to know more, you can visit their website. About our upcoming dental webinars, we have a webinar tomorrow with Dr. Mahmoud Atiya at 9 p.m. Indian Standard Time about the concept of minimal invasive and full mouth rehabilitation. On November 16 at 5 p.m. Indian Standard Time, we will have a webinar about medical legal aspects in dentistry with advocate Mudit Marwa and Dr. Aditi Mishra. On November 27 at 11:30 a.m. Indian Standard Time, we have a webinar about legal aspects of dental practice Part 2. If you didn't attend Part 1, you can find it on our social media platforms, YouTube, and our Facebook page. About our upcoming dental workshops, we have an online workshop, 10 days online workshop, happening on November 20 about forensic odontology batch 3 with Dr. Arushi Shawla. Course highlights, detailed online lectures, international certification with 20 CPD points, WhatsApp mentorship, assignments, and much, much more. I would like to invite you to join our second World Implant Expo 2021, happening on November 5 via virtual platform, with more than 30 speakers, 30 CPD points, and live interactive sessions. If you have any question, kindly call or WhatsApp this number or visit our website events.DentistChannel.Online. Last but not least, if you're not a Prime member yet, don't forget to join our family to benefit from free certificate of participation after every event, exclusive discounts and special offers on online dental courses, hands-on dental courses, and much more. Please don't forget to follow us on our social media platforms, Facebook, Instagram, YouTube, and Twitter. So now, Doctor, we can move on to the question and answer session. Yes?
Ready for it.
I think all is fine and clear. We don't have any question. The topic was very well presented. It was very clear. Thank you so much, Mr. Karam Korya. It was a pleasure having you with us.
Pleasure for me as well. Thank you for having me and looking forward to joining you guys in other seminars soon.
Hopefully soon. Thank you so much.
Thank you.
Have a nice day.
You too.
Thank you. Bye.